my name's Lili Berescu. I use they, them pronouns, and I was previously one of the harm reduction core program leads with NSWOCC Canada, where I had the pleasure of being able to work on the best practice recommendations document for wound care and people who use drugs with Open Inc. with John Gregory and our fabulous team with the BPR. And I have a various background in community care. My heart and soul is in community care, and particularly in harm reduction, where I worked at our local safe consumption site before it ended and closed last year in 2025. I am currently at the WCT Joint NSWOCC Canada Conference Congress here in Vancouver, BC. The BPR was an important project, particularly for myself, because both working in traditional health settings and non-traditional health settings, I saw firsthand the disparity that folks experiencing health inequities, particularly people who use drugs, the disparities that they faced trying to access health services, particularly in traditional health settings, and the outcomes that they would have, the various complications that they would experience with their wounds, and the differences in care that they would receive in different settings. So it was important for us to explore this, open this up and make people aware, and start the point of conversation for folks in this area. As I mentioned, and as several people have mentioned too, is that this is the start of a conversation which we kind of dove into with our podcast with NSWOCC Canada, where we had Priyanka Johnny, Corey Ranger, and Andre Solinsky. I had the pleasure of speaking with them about the BPR and its value for implication in practice. Realistically, what we're wanting to see with this is just a start, right? And it's more important now in this climate more than ever, is to highlight the evidence that we're seeing in literature, that we're seeing, hearing from people with experience, hearing from people and community members, from what they're experiencing firsthand. So it's important that we're taking all of that knowledge and expertise and we're putting it into practice and policy. So this is the start of hopefully something bigger and the change in having better health equity in wound care for people who use drugs. The development for this best practice recommendations, the process of it, because this was my first time, was very new, and it was definitely not traditional, not the same way that people had previously experienced the process for best practice recommendations. We took things very slowly with this project. We spent a lot of time really being considerate with each portion and considering all of the different perspectives of everyone in our group that we had, as well as the consideration of the reviewers as well and their expertise. And we wanted to make sure that we were being as considerate with each portion as possible, because we wanted to make sure that we were doing this the right way as possible. And these being best practice recommendations, they will be adapted to different communities in different ways, because no community is the same, no individual community member or individual are the same. And so the way that these recommendations will look on an individual basis will really depend on each community and each healthcare provider, the way that they implement it. But it was important for us to be as well informed as possible and well-rounded with our process in this project. Currently, so we're here at the conference in April 2026, and our current government is looking to further defund the remaining safe consumption sites in Ontario. Last year they had done the same, and our local site in Kitchener-Waterloo was closed March 31st, 2025. And I believe there are around eight sites that are still remaining in Ontario. And despite seeing in the news and different news blasts, hearing from community members of increased overdoses and increased complications, we have tranquilizer contaminants in our street drug supply. So we've had folks who have been experiencing frostbite because they've been unconscious and unable to have sensation. So we've had many different complications arise from this. Emergency services have been overloaded. Despite hearing all of this, it is the current government's, provincial government's plan to close the sites as of June 13th, 2026. It seems you know, the politics are kind of changing all throughout Canada. It seems that Alberta may be taking suit as well. And we've had recriminalization of drugs in British Columbia as well. So it's unfortunate the changes that we're seeing in our current political climate, both federally and provincially. And this is why I stress that it's more important now than ever to be looking at the evidence, because these decisions are not being made based off of evidence. We know how important it is, especially with healthcare and health outcomes and overall well-being, to be evidence-informed and person-centered with our care. So we have the harm reduction community of practice with NSWOCC Canada, although we do ensure that it is harm reduction focused and a safe harm reduction space, we do also recognize that within harm reduction and for people who use drugs, it is very intersectional. So we also talk about other health disparities or other impacts of social determinants of health, such as housing, food security, routine hygiene, access. So we welcome any individuals, whether they are NSWOCCs or SWANs or anyone. You don't have to be a health professional to this group, as long as you have an interest and passion for speaking to either your own experiences or your care experiences, sharing information and knowledge about health disparities within wound, ostomy, and continence care.